Good evening, dear viewers, and welcome once again to your program Healthlink, brought to you here in the studios of QTV every Monday by myself, Dr. Abubakar Jah, and my co-presenter, Loli Kamara. Today we have very important guests, and we apologize for the slightly late start of the program, and we hope that we can start quickly so that we can gain some ground, because this is really a very important topic. As usual, before we go on to the topic, I just need to remind the public that COVID is still around. That is why we are still wearing our masks. Even though we don't have many cases, the same advices we've been given here every week still apply. I don't want to go into much more details on this so that we can have some time to talk about this very important topic. Mbokk yi ñu ngi leen a nuyuwaati fii nii ci seen programme yi Healthlink bi nga xam ne man Dr. Abubakar Jah ak Loli Kamara ñoo leen ko dee indil fii nii lundi bu nekk di waxtaanee seen wér-gu-yaram fii ci QTV. Tey nag ñu am ay gan yu am solo yuñ bëgg a waxtaanal ci benn mbiri wér-gu-yaram boo xam ne bu am solo la, waaye balaa ñoo commencé rek comme niñ ko dee defee ñu fàttali leen ne feebari Covid bi ba tey mu ngi fi, moo tax tey ba tey ñu ngi sol suñ masque yi. du ma dugg nag ci yu ma daan wax semaine bu nekk parce que ñu ngi ko fi dee wax semaine bu nekk, ñu fàttali ko ne yooyu noonu yëpp ba tey mu ngi fi. Loolu
baraka bake docteur assalamu alaikum badi mon miliyar ko wolle ben jube kanyum tembe na QTV alla jata kende akacha mi mo Healthlink min kanale tene wotane wala murutana e commune dal takala nyame jani beddu na kacha ko non se diamu coronavirus la e fantanko la fanna bari bi monta diamo umendi la wo fannanin e kantu wato min bembula mansia bari kamol hakkilo bulani ko face mask on sa kata ka dum e luntan kuma le bembulu bi andumbe kacha la fanna min na mi an ko wala mu jata kende ala bundade kacha kuma balem woton sel na moy docteur sina luntan take bismillah kana kacha da yel.
Thank you very much, Loli. Yes, as you can see, we are wearing our masks, so none of you can see our beautiful white teeth smiling, which is very important. But apart from using your teeth for social reasons and using them for chewing, there are many more things to do with the teeth. And today we have some specialists in this field. The first one that we'll be talking with is a long-time colleague of mine and a very dear colleague, Dr. Victoria Okoje, who has been here in Gambia helping us for several years now at the teaching hospital as a consultant maxillofacial surgeon, one of the very few that we have in the Gambia, doing a great work, while she could have done the same work in her country at even a better pay than what she is receiving here. But I know of her love in the Gambia, and that is why she is here. You're very welcome, Dr. Okoje.
Thank you.
So she will be taking us through with his colleague, who will be introducing in the next few minutes on why, what are the problems that can affect our teeth, and why we need to keep our teeth healthy, and how do we do it. So that is the program today. Mbokk yi tey kuñ fi amee nii mooy docteur Victoria Okoje, muy docteur bu mag ci mbiri bëñ nag lu am solo la, nekkut ne pour ree rek la wala pour signe rek nga xam ne nit nañ gis ne sa bëñ yaa ngi rafet, waaye am na yeneen yu bëri yoo xam ne bëñ daf ko dee def. tey dinañ dugg ci yooyu noonu mu waxtaanee ñu suñ mbiri bëñ yi. muy docteur bu mag nag ci mbiri bëñ yi fii nii ci lopitaani Banjul bu ñoo ooyee EFSTH. bokk na si ñi nga xam ne ñoo dee jàngal suñ docteur yu ndaw yi ci mbiri feebari bëñ ak feebari gémmiñ ak yooyu noonu. kon kontaan nañ trop pour am ko fii nii pour mu waxtaanaa ñun tey loole.
o kumata bake comme aliya moy docteur la nyame ngal lunta men folo jia nyin tembe na wala mu docteur Victoria Okojeti ate mu docteur olti mi alon ko waka mamma nyingol la fanna nyinelta e nyingol nata ke kudi mi alon ko comme docteur ya fo nyama manke pour ni jelta mole nyin ko yoje e wala ni simalta mole nyin ko yoje bari nyumu kudi mi alon ko aka ku jamale fanake e hadama dun jato kono wotala kumaya kama e docteur mi alon ka tele botanan e lopitan bumba to memu banjunti e bi nabe kacha me yankol be dandi nyingol la kula docteur Okoji butungi fana bismillah comme docteur ya fanya sila bina duna kacha ko no mi yankol be dandi nyingol la fanna nyinta bi wala mu kacha ko.
Thank you very much. Dr. Okoje, you're welcome once again to the program. So we just initially want to know what is the importance of the teeth in a human being, and how does your field come into this aspect, so that our viewers can understand that.
Okay. So, good evening, beautiful Gambian families. I want to talk about oral health. I think that's the question you're asking about.
Yes.
The importance of the teeth and how we should take care of it. Maybe I should just give a preamble of some things that, since I've been here, I've noticed some things about the health in the Gambia. And oral health is I think it's a serious, a matter that should be taken seriously. And I just wanted to give a few points that the cleanliness of the teeth is as important as the cleanliness of the body, especially in keeping diseases far from you. You know, when we were little, I'm a Nigerian, so as children we had this song that we had to sing, that when you keep your body clean and your teeth clean, then you are free from diseases. It's as important as that. And then the other thing is that when you come into school, you kind of spread out your fingers. You know, they check your ears and then they check your teeth just to make sure it's clean before you go into the classroom. So it's something that you start very early, taking care of your teeth. It's part of the well-being. And then the other thing is, usually when you take care of your teeth, it's obvious that you'll be free from different diseases, because there are so many diseases that are reflected in the mouth, and they also affect the mouth, the teeth of the patient. And that's why we talk about cleaning, and cleaning at least twice a day. If you can make it clean in the morning, sorry, when we're talking, the mask goes down,
Okay.
and clean in the evening, then you keep the teeth as clean as possible. And some people wonder, is it possible to do that? You just make it a habit. Just these few things I want to emphasize before we go into the different diseases. Once you can keep your mouth clean in the morning and at night, then you reduce the sugar load or the food debris. You reduce the amount that the bacteria in the mouth can act on and cause diseases, because the bacteria in the mouth that will act on these sugars, and then they cause caries that you see in the mouth, or they cause gum diseases when you don't clean it very well, and all those things have the impact on the health of the person. And then the main thing we see is with the gingivitis, that is the gum disease, with the caries, then you now have pus collection, very terrible diseases like cellulitis, necrotizing fasciitis, just because you did not clean properly. And because you need time for the bacteria to act on the food. So cleaning helps you to reduce, to disrupt the bacteria from around the tooth, and at the same time not allowing time for it to destroy your tooth.
Thank you.
And it's usually better from very young when you start it.
Thank you very much, Dr. Okoje. Just like I suspected, Dr. Okoje is a teacher. She teaches in the medical school. Whenever they talk, you have to speak, you have to listen very carefully. But because even in between the lines, there are lots of things. What I have learned, and what I want Gambian people to learn from this is, number one, it starts very early, oral health, and therefore our schools should emphasize on this. She tells us that back in her home, the schools emphasize on it. I am not really sure whether our own schools here emphasize on it, but they should emphasize on it to the children, make sure the children are keeping their teeth clean, so that it doesn't affect them later in their life. The other thing that I have learned from what she has said is that actually oral hygiene, just like I was talking about, does not only even remain in the teeth. Apart from causing problems in your teeth, it can actually cause problem in your general health. It can go to the other systems. The fact that you did not keep your teeth clean can also affect the other parts of your body. I think this is all I have taken in between the lines of what she has said, and I think it is very, very important. So those teachers that are listening, those people in schools that are listening, please convey this to your students. mbokk yi Dr. Okoje lu ma ko njëkk a laaj mooy buñ naka lañ ko mun a toppatooyee ba nga xam ne nit du ci am problème ak ñoom ci seen liggéey naka la ci gaa yi duggee mu ne moom lu mu njëkk a wax bugg a wax mooy ne buñ pour toppatoo ko dañ ko war a teel a toppatoo mu ne moom fu mu jógee ci Nigeria ñoom nuñ dee def mooy ci seen école yëpp dañ am curriculum boo xam ne su xale bi ñëwee balaa moo dugga ci biir school bi dinañ seet baaromam yi ndax mu ngi set, dinañ seet tamit gémmiñam bi seet buñam yi ndax mu ngi set, jàngal xale bi ne seti buñ ndekete lu am solo la. am na leneen luñ jàngee si moom fii nii mooy ne ndekete ñun ñu ngi doon foog ne rek buñ yi su amee problème buñ yi rek a am problème waaye ndekete du loolu rek am na feebar yi si biir yaram bi yu bëri yoo xam ne lu ko waral mooy toppatoowuñ suñ buñ yi. wax nañu ne tamit buñ yi nit war na koo raxas lu mu bon bon ñaari yoon ci bés bi. lu mu bon bon nga raxas ko fompa ko setal ko ñaari yoon si but bi. xam naa nag dinañ dugga si naka lañ koo toppatooyee naka lañ dee toppatooyee buñ bi ci biir programme bi ma bàyyi loolu yi wax loolu noonu. dinañ jël break bu ndaw, dinañ change programme bi tey tuuti pour mun cee gën a am luñ ci bugg a am. mooy ne suñ jëlee break bu ndaw dinañ indi suñ beneen gan bi wanale ko ak suñ déglukat yi si kanam tuuti nag ñu door a indiwaati loolu yi mu faram fàcce luñ waxtaanee yëpp ci kàllaama Mandinka pour tam suñ mbokki Mandinka yi tamit mun ko understand. waaye foog naa lii la Dr. Okoje wax Dr. Loli.
Dr. Okoje mi fo Mandinka muta angale kanto wala mu docteur ya nyininka nyingo mba keno la nyaadile pour ka seneyandi aninka topoto ako ñewmu kulti mi yalon ko ka topoto a nyanta dati la birin dindinne anata simunta drum misalol ditella karambuto ke karanik barate mum mol mi anka bota Nigeria ke karandile ni nata somandar jandi be dunna se bul kono diwul be jube ke tulol jube ke ñuul jube faabe seneyarinde ka yitandi la ko ñewmu fenade mi anko ñanta topoto la pour que tankandi courant la ñew fana ya yitandi ko diam fenade mi anka manda ñindi mu damal barna ye dimi aset ni munta dray jinu balola fanna dol fana ka kamantoro sabo barola fanna dol to mi anko courant dol fana se wulunol woto ka ñingo topoto akumata bag anata yitandi ko ñingo sa muta ka ku sinya flatilo ko no kumata bake samanda ani sutola bari niyoke domorol mi yalon ko yewole ke sutola sabe kuno fabe senea ase tankandino ani sukoro fana sa talano ñingo la fanna ñindo o se tankandino timol fana bu kultimi anko ni ñingo ye dimi watda sa sabu no timol be jiti wala timol ye dimi o fana mu fanne mi yalon ko bebe chokkedi ñin dimunto wodo ñimu fenne mi anko mol ñanta topotola adu ñanta sayla le ka je ko de ngata ngake kudmi anko ba sahayandel docteur fana nata ñi yamarodi karandir la mi yalon ko wolle be ñim programme wala moy kandi ba jube ka ñim temben pour naketa man tara fo kan karambo mundal e fanal sela kata ko ke kaje ko de yenna dindul karandal ya yitandi la ko ñimu fente mi an ko ñanta dat la ka to boto birin dinding ina e menyol ase mol tankandino bi programme o ñing abe falina domande barate mela be fonyon dimutala be na luntam fula nyaw dundilana no duntana butun taba yam fala te kumolta ka seyinka na botala mbina be tala ka sa testa ka seyinka purun badi mandin kol fanay ya lon kol be nyame bi programme o be laari wala nya bari ñula fanal hani bi be tenten na wala doctor.
Thank you very much, Loli. So what we're going to do is we're just going to take a very small break to bring in our next guest and continue the discussion, and we hope to see you soon.
Q Money, the biggest mobile money service in the Gambia, has taken mobile banking to the next level. Now, you can link your Q Money wallet with your bank account. Yes, link your Ajib or EcoBank accounts with your Q Money wallet and get instant access to your cash anytime. No need to queue at the bank anymore. Transfer funds from your bank account to your wallet or your wallet to your bank account using Q Money Bank Link is the fastest, most secure, and convenient way to transfer funds between your wallet and bank account. For more information, call our customer care on 133. Q Money, Sunyu Kalpe. Terms.
Thank you very much for staying with us. We are still continuing the discussions on teeth and oral hygiene, like Dr. Okoje mentioned. And we now have our second guest, Dr. Kelvin Omoje, who is also a consultant maxillofacial surgeon who has recently joined us. I am sure one of the people that Dr. Okoje attracted to the country. I'm not really sure, but I'm suspecting it's something to do with that. But you are very welcome, sir, to the program. mbokk yi suñ beneen gan bi Dr. Kelvin Omoje moom tam dugga si na léegi nii dinañ continuer waxtaan bi waaye balaa ñoo ñëw ci moom dinaa dellu ci Dr. Okoje am na lu tuuti rek lu mu war a wax den ñu door a invite Dr. Kelvin mu waxtaan ak ñun. Ladies and gentlemen, I'll just ask Dr. Okoje to make a small introduction, and there's something she wants to talk about before we give Dr. Omoje the mic.
I just want to talk about the fact that we also have to be familiar with our mouths, the oral cavity. Don't be afraid or ashamed to know your mouth, so that if there is any change or any strange thing, you can quickly seek, expert attention. There is no need delaying. I think because of delaying when there's dental problem, that's why in the Gambia they can have something like, when you are pregnant, you lose a tooth, or if you lose a tooth, you will die. That's because they have delayed whatever problem that they have. Because sometimes you brush, but you don't brush. We can't brush everything, you can't do it well. And that's why we also recommend that every 6 months we should go for scaling and polishing with our dentist. Even if we don't have any problem, by the time they come close and they're cleaning for us, we can pick out things and treat them early before it becomes too late.
Thank you very much for that. I think that's very clear, is to report problems early rather than waiting until it is too late, and also 6 monthly visits to the dentist. I am guilty of not doing that myself, but I will try to make sure that that is being done from now on. So it's a very good lesson. Dr. Omoje, you're very welcome. And thank you for coming on to this program, and thank you also for giving your services to the Gambia. You are highly welcome. So we are going to maybe talk about some of the diseases that can be found in the mouth. I think we have some pictures that our producers can show on the screen, and maybe you can take us through some of those things. You're welcome.
Thank you very much. Yes, the oral cavity is a major part of the human body. And Dr. Koje has mentioned that is the gateway to the body. And I am sure you agree with me that if the person guarding the house is having a problem, the whole house is vulnerable. So when the mouth has an issue, when there are issues in the mouth, feeding becomes a problem. Most of the things you do in the mouth, swallowing, speaking, those things becomes a problem, and it forms a major aspect of our psychological well-being when they are impaired. The parts of the mouth, like Dr. Koje was talking about, you should know your mouth. We have the soft tissues, which include the tongue, the gums, the cheek, the tissues in the oropharynx, the soft palate, and all that. Then we have the hard tissues, especially the teeth. It's important to know these structures and know the optimal condition of these structures in health. And then when it is diseased, you also know when it is diseased. There are so many diseases that can affect every part of the oral cavity, but we'll pick them one after the other. Maybe not in this episode. Subsequent episode, we can go much more into them. But let me just pick the gum diseases, for instance. The gum, we refer to the gum as the gingiva, medically speaking. And the commonest problem that occur in the gum is gingivitis, when we have inflammation of the gum. So many things can cause inflammation of the gum. Commonest of it is poor oral hygiene. When the oral hygiene is poor, the gum becomes diseased, and when the gum becomes diseased, the first thing it does is that it loses the natural form, both the contour, the shape, the way it looks, it changes. A healthy gum usually appears what we call coral pink. It's pink in color. So when you begin to see the gum become red, it's already diseased. Normal gums does not bleed, and the peaks, if you look at the pictures they are showing on the screen, the peaks of the gum appear like spikes. When it starts becoming rounded, it's because the gum has become inflamed. When you brush on the normal gums, there is no bleeding. But when you start brushing your teeth and you start seeing blood on your brush, start seeing blood on the things you are spitting out from your mouth, then the gum have become diseased. These are the things you have to look at. Several other things can affect gum. It can cause gum inflammation of the gingiva, which is one of them is hormonal changes, maybe like you can find during pregnancy. Some drugs can cause the gingiva to become inflamed. People who are managing maybe diseases like convulsion, people that are managing epilepsy, who go on some drugs like phenytoins, those drugs can cause gingival inflammation. People who are on antihypertensive like nifedipine and different drugs, they can cause inflammation of the gums. Other ones are allergic conditions, foreign body impaction like fish bone impaction. Others are use of dentures. If you're not using your dentures, your artificial teeth properly, it can cause gum inflammation. But we are very much particular about poor oral hygiene and inflammation of the gum. If you look at the picture that I showed, you will see that the edges of the right around the teeth, you see some yellowish deposits right around the teeth. We refer to those things as tartar or calculus. Those things usually occur. I'm sure you know that when you wake up in the morning and you use your finger to rub through your teeth, you feel some slimy things on your teeth. When you brush off, those things goes off. But when you are brushing in a wrong manner or you're not brushing at all, those slimy things gradually becomes calcified, start hardening up, and start appearing as the things we are seeing on the screen at the moment. Those things are the beginning, are the major etiologic agents that cause gum and mouth diseases. This is what we refer to as calculus. Those things tend to irritate the gum, make the gum to become inflamed, make the gum to start bleeding. Those calculus. And for you to remove those things, you must be able to understand how to brush properly. You must be able to understand when you need help for you to be able to brush, because it's not every time that you can brush off completely, because you see that you can only be able to brush the part of the teeth that you can see in the mouth. But remember that the teeth has a component beyond the mouth, inside the bone, and the gum covers a part of it. And even within the gum, sometimes you will see that there are aspects of the mouth beyond the gum that need to be cleaned, and those things are the ones that requires doctors assisted cleaning or hospital assisted cleaning, for you to be able to what Dr. Okoje referred to as scaling and polishing. Yes. Those things are what will help you to clean the teeth properly. If you look at this picture on the screen, you see the brush. Before you start brushing, it's good to look at your brush first and be sure that your brush is in optimal form. And what you are using to brush, usually we recommend use of toothpaste and fluoride toothpaste. There are different kinds of fluoride toothpaste, but you must make sure that there is fluoride in the toothpaste you are using, because it's one of the most active ingredients that is necessary for healthy teeth development. So when you are using a fluoride toothpaste, then you look at your brush. Most of the time, if the bristles of the brush are beginning to slide down, those brushes need to be changed. Look at these brushes very well. Usually, there are three different types of brushes.
The yellow one needs to be changed.
Yes, there are different types of brushes. We have the soft brush, usually more for children. We have the medium textured brush, usually for most adults. And we have the hard brush. Hard brush is usually for smokers, people who take habits like coffee, and other who have stains in their teeth. So a normal healthy adult who does not take coffee, who is not a smoker, does not need a hard brush, because hard brush will begin to remove the surface of your teeth and expose your teeth to some of these conditions we'll be talking about in the future. So you have to make sure that your brush is optimal and the right brush for you. Then the toothpaste you're going to put, we also recommend just a peanut-sized toothpaste, just a small drop. Not that you have to run the paste across the entire length of the brush. No, just a little amount, like a peanut size, is enough to brush your teeth. Then the most important is the technique of the brushing. If you look at the picture of brushing that was shown, you see that the brush was inclined at 45 degrees from the gums.
So maybe we can show that picture again. They can help us show the picture again of the brush. Yes.
Yes, you can see that first of all, you start from the upper teeth. You start brushing from the upper part of the gums, and you are brushing it down through the surface of the teeth. So you are massaging the gum against the teeth. If you start brushing the upper teeth from down up, you'll be lifting the gum away from the teeth, and you'll be causing more problem. So what we are interested in doing is that we are interested in massaging the gum down back to the teeth. And for the lower jaw also, you are brushing it from the down up, because you are interested in massaging the gum through the teeth. So these are the things you do. And you must brush the left side, the right side, the facial surfaces, the inside of the mouth, and then most importantly, you must brush your tongue every time you are brushing, because there are a lot of microorganisms that also inhabit in the tongue. You must scrape your tongue. There's also some tongue scraper that comes with some toothbrushes that you can use to scrape your tongue, and make sure that your breath is good. So when these things are not properly done, over time, these slimy substances become hardened, and then they form calculus, or what we refer to as tartar, and they become the etiologic agents for most of the dental diseases.
Thank you very much, Dr. Omoje. I think we have talked about it all, very important aspects. So you've talked about the diseases that can happen in the gum and in the teeth. You've also talked about the brushes, how we can choose our brush, and also how to brush. I mean, a lot of us don't know. A lot of us, when I started brushing, I used to brush from side to side rather than brushing up and down. It was when I met a dentist that they told me that, no, you must brush it from up, down, towards the teeth, the upper ones, and then the lower ones from down up, and then make sure that you also brush the inside of the teeth rather than just brushing the outside of the teeth, so that the outside of the teeth look white, but when you look inside, everything is yellow and full of tartar. So I think these are very important lessons for our viewers and listeners to hear. So what we will do is I will start this translation in Wolof, and we will get Lolly to come back and translate this to our viewers, and then maybe we will get Dr. Okoje to talk about some of the common diseases that we are coming across here and how we deal with them. Mbokk yi ñu ngi leen a nuyuwaati fii nii ci programme bi. Docteur Omoje lañ doon waxtaanal léegi nag wax na lu bari loo xam ne xëj na du ma mën a dugg ci yëpp, waaye suñ gaa yi wanatee nataal yi lu mu doon wax rek mooy bëñ bi luñ dee gis ci biti nekkul lu nekk ci biti rek, am na beneen bëñ boo xam ne mu ngi ci biir yax bi, tegu ci biir yax bi, moom it du dee feeñ waaye dina mun a am feebar. mu ne nag feebar yu ëpp yu dee di nekk si gémmiñ bi mooy feebar yoo xam ne ñàkk a toppatoo suñ bëñ yi moo ko dee waral. te soo ñàkkee toppatoo sa bëñ yi lu dee xew mooy yu ratax yu dee nekk si bëñ yi yooyu noonu moo dee di comme ñoo gis nii ci télé bi nga xam ne yaa ngi koy gis mu ngi mel ni lu nete yooyu noonu, lu ratax loolu noonu moo dee tegu foofu noonu. Nga gis ne léegi nii dafa dëgër, su dëgëree mu nekk lu mel ni ay xeer yoo xam ne mu ngi foofu noonu, suñ ko bàyyee foofu noonu dina yaaxa bëñ bi, dina tax bëñ yi xesew, dina tax gémmiñ bi si boppam ci biir mu xesew. wan nañu nag yan façon yi brosse lañ dee di war a use. broche yu mu wane noonu wan nañu ne ay façon yi broche ñoo am na benn boo xam ne bu nooy la. bu nooy bi mu ne xale yi ñoo ko war a jëfandikoo. mu am boo xam ne dafa xaw a dëgër tuuti, bu xaw a dëgër tuuti bi boobu noonu mag yi ñoo ko jëfandikoo, mag yi nga xam ne amuñ problème. mu wax fi nag lu am solo mooy mag yi nga xam ne dañoo tux cigarette. yàgg nañ di wax fii nii mbiri tux cigarette naka la bonee, musuma koo wax nag ne bëñ yi ci la bokka, waaye kii wan nañu ne bëñ yi ci la bokka. tux cigarette dafaa yaaxa bëñ yi. mu ne ñuy tux cigarette nag ay ñuy lekk guro ak yooyu noonu, broche yu dëgër yi ñoom la war a gaa yi use. mu ne soo koy use nag lu gën ci looy use mooy toothpaste bi nga xam ne tuuti rek nga cee def, doo ko def ba mu fees del ak toothpaste, tuuti rek ngay def ci biir broche bi. sooy broche nag naka nga war a brocher loolu lu am solo la, mooy ne broche bi naka nga ko yëngalee si biir gémmiñ bi. mu ne nag bëñ yi nekk nga xam ne moo nekk ci kaw, bëñ yooyu noonu soo ko broche dangaa commencé si kaw ci fu ciiñ bi nekk nga wàcce si suuf ci bëñ bi. soo ko ekkatee ci kaw ci bëñ yu nekk ci kaw nga ekkati ko ci kaw dafaa yaaxa ciiñ bi. soo bugguloo yaaxa ciiñ bi da nga ko wàccee ci suuf mu ànd ak bëñ yi. bëñ yi ci suuf tamit ci suuf ngay dooree jeexalee ci kaw ci bëñ bi. soo fooy raxas si gémmiñ bi rek si ciiñ bi ngay njëkkee mu dem si kaw si bëñ bi. ba pare buñ fàtte tamit di raxas ci biir gémmiñ bi. xam nga am na ñu bëri su ñoo broche si kanam gi rek la ñoo broche, waaye ci gannaaw bëñ bi tamit am na lu ñu war a broche comme nuñ ko wanee ci nataal bi ci suuf noonu. wax na ne tamit làmmeñ bi tamit lu ñoo war a broche la, parce que ñu bëri dañoo broche bëñ yi rek fàtte làmmeñ bi, te làmmeñ bi am na ay jàngoro yu fa nekk yoo xam ne tamit tuuti war nañ ko génnee. suñ ko génneewut dafa des si biir gémmiñ bi te dina indi yaaxa yoo xam ne mu ngi fa. wan nañu ne nag ne gémmiñ bi mooy bunti yaram bi, bunti yaram bi nag luy garder yaram bi su nekkee moom ci boppam am na feebar comme ni ko docteur Okoje waxee rek feebar bi mun naa nekk ci biir yaram bi yëpp so ci gàttal daal lii la docteur Omoje wax ñu bàyyi Lolly mu wax loolu noonu den ñu door a continuer programme bi
abarka bake docteur comme docteur Omoje ya fo ñamen ay munta don ñiw la kuma yitandi ani ñiw mo ñanta to poto no la ñamen ay follow comme ya jalla télévision to ñamen brosol la façon la fintini brosol mi ya lon ko mo ñanta wolta la pour que ñiw suswala brosol sabales fintindi follow wole mo brosi demande on mi ya lon ko abe foyarende ay ko de wo dindingol le so tano ke da brosala muta ke da susala brosi temon ko wala mo broso de mi alon ko ke bal fana sa muna fanno wala nyanto le tala pour que da susala nata bros sabanya min fo wala mo bambandi wonyenti wo mum molen mi alon ko ke bala molen andi ka sabaro leke wolde wala nyanta ko ta ni mi alon ko ka nyin ko fita ka min ni ko ke nyante nyuta ka susa wala nata yitandi dalilo mi atinna mo nyante nyu susa la wala kantum mol mi yanko buka muta drom buka sabaro kandi buka nyin ka filming ni ke nyu susa wala ase nyu la chloro nyin tale ka talano wota kumata la pour ngalon façon nyantanda bros la milla anata yitandi fana ko damu fennati mi yalon ko nyanta topotol kantu wati jama fenol kan nakira balal ni domoro ke meda ko senya ka jele wati jama nyin fennamol setarano jele asita faye ala chloro e falling kennete mun koti o fana mu kudi mi yalon ko mul nyantan hakilo tulatole nata fo fana isa ke no nyaade pour que fantan kandar kuma jama fo comme ali aja la télévision to nyame ni nata fana timol la yitola wol be mu kudi mi yalon ko nyiwla topotoli baliya wala kasum wala nyi fennete mun ko mi ankal bole je ka la tele no wol be mu kudi mi yalon ko mantara jata kende ala bunda nyi nyiwol fana sabaro la fanala o fana katina le nyul ko komo ka kenyin se fati o kamala nyante nyul talal ka brosa seneya adu nyanta lon ne ba bros la nyame ako broso fana manke dore ba talale ka tutpe so ta safuno mi yalon ko kole ke broso bal ka keje faesia hani domandin doron e nyanta tondila e la broso nyin kanne adu nyanta datila timo e santol ina e ji dumala e nyanta datila nyungla santol timo do kada ji dumala broso fana few fandi bakele nyante da kula wala nyam duma fana ni bakele nyanta datila timol to ina e ji san ina e ji kata santol ni ba kule nyanta kula wala nyam adu nengo fana mu kuleti mi anko nyanta a brosla le nyanta suza la fa sene wol be mu kulti mi alon ka kumata adu nyu konoto fana nyanta ka susa fa sene amanke be banta dam male tala ka susa ni banta susa fa sene ya dum broso e konoto la ya bu nyu fana ta ka brosi konoto la docteur ni la fo niyo ke tumando ase tankandinol bare courant fo mi alon ko wala be nyu la fana nyu mu kulti mi alon ka ni courant jamal le be sutiari nyol comme a senka nyamal ya moy nu nyame woto ngam fantankandi anin comme docteur ko jiya fo nyanta wulla courant e junale pour ka kele ni tarde ta courant la mantora jama akole sabo woto kari woro kumata le pour kata jaral bundato ka cekkiro ke nyulla o fana mu kultimi yalon ka kumata baage ase tankandinole asatina nyingol enayto comme tal nyo sifa ngal nyindol wudo bari hani bimbe karambungol do nga fendol karana mi yalon ko kumata baage.
Thank you very much, Lolly. So what I will do is Dr. Okoje will come back to you while we get Dr. Omoje, not saying the name very well, but Omoje, to come back in and discuss some more aspects of the teeth. So we would like to know some of the common diseases that you are seeing in the Gambia on patients with their teeth.
Patients, yeah. With the teeth, we see a lot of caries. That's the bacterial infection of bacteria eating up the teeth, more or less. And this has a lot of complications. From that tooth that is diseased, you can have pus collection because it's bacterial infection. With this pus collection, say you have an abscess. From the abscess, it can move into the soft tissue planes in the face, and you have what we call cellulitis. With this, there's already bacteria being thrown into the blood vessel and into the bloodstream. And the patient can have septicemia. The patient can even go into septic shock. The patient can throw and, pus embolus. And it can cause a lot. It can even there can be necrotizing fasciitis, because sometimes the soft tissue itself, because of the pressure or because of the product of the bacteria, the blood supply to the skin can be compromised, and once that is compromised, the skin will die and it is slough off. So we see so many things of patients losing the skin, and then pores all over, right through the trachea, the neck, the abdomen, and it starts with this bacterial infection of the tooth. And this is a disease that can be prevented if you do good oral hygiene care. But even if you don't and you go early to the doctor, it can be filled. You know, he says you want to go and restore a tooth because it's already cavitated by bacteria. So you can restore it and nothing, it will not extend that way. And then usually when the caries extends that far, that means there's something wrong with your immunity. Either you are anemic, or you are diabetic, or you are pre-diabetic, that there's a lot of sugar in your blood, or you have other complications that the doctors need to manage. So this is the time to quickly go to the dentist. They will diagnose it, and they will be able to diagnose other systemic ailments through that. We see a lot of tooth erosion also. I think because people take a lot of acidic, they take their lime and juice, they take it directly, and that erodes their anterior teeth. So that's another complication. We see, what else? We see, I know most of the time is this cellulitis. I wish we had the picture. Because
we will come back next time.
It's usually, yes, it's preventable, and it's so sad that many patients, many people lose their lives because of the complication of a toothache or from the gingivitis he mentioned, because the sequelae is the same. You know, is the bacteria, the infection spreading through the bloodstream, through the tissue space, and then causing some complications.
So I think that's a very good lesson for us all to learn, that the teeth is not only the teeth. The whole body can be affected just because one tooth has been affected, and people have lost their life because of a tooth infection. Dr. Omoje, we are going to open the line 5050505. I doubt we'll be able to have many questions, but we'll open the line and get a few questions if the viewers want to ask questions. But while we're waiting for that, there's an important question I want to ask, and I'm sure a lot of our viewers would want to ask that question.
Yes.
Chewing stick.
Yes.
What do you say about it? What is it? Is it beneficial? What does it do to our teeth and so forth? The stick brushes that people use.
Okay. One of the old methods, there are different methods people use in brushing. Some people use even charcoal. Some people use chewing stick. There are different trees that have different properties that people use to brush, aside the chemical method of brushing using mechanical and toothbrush. But the challenge about chewing stick is that, you know, there are different sticks that people use. It only provides mechanical removal of debris and deposits on the teeth, and beyond that it does nothing more. But remember that when you are using toothbrush, you are using toothbrush together with toothpaste. Toothpaste have other chemicals, like I mentioned, fluoride. This helps to sometimes somebody is beginning to have some decay, minimal decay, very little decay. The fluoride in the toothpaste can make that tooth to go back from that decay. If it is just cut at the very early stage, they can remineralize the tooth and return it back to the way it used to do before. Chewing stick will not do that. And I'm not sure of any chewing stick, the stick that has fluoride in it yet. It may be possible, but I'm not sure of anyone that has fluoride. So all they do is mechanical. But rather than not doing at all, it is good to use mechanical method to remove debris from the teeth, rather than not doing at all. But preferably, it's better to use toothpaste. There are other options of what people can use to also reduce bacterial load and debris on the teeth. One of them is use of mouth washes. There are chemical mouth washes, Cosodil, Pepsodent, different mouth washes. Those mouth washes also play a lot of role in reducing debris in the mouth. People have employed different methods of utilizing this thing. Like Dr. Okoje said, usually advised for people to brush twice daily. And the twice is usually, we advocate when you brush in the morning after food, then you brush in the night, last thing before you go to bed. These are usually for people people who brush last thing before they go to bed, we advise them to brush in the morning after breakfast. But people who didn't brush last thing before they go to bed, usually advisable that such people brush in the morning before they have their breakfast. Okay, but chewing stick will only remove the debris and will not be able to do more than just removing the debris from the teeth.
So for what I'm learning from you is that even if you use the sticks,
Yes.
which they are very useful,
Yes.
but even if you use them, you should still use your toothbrush in the morning and in the evening.
Yes, or you can complement with chemical mouthwashes, because those ones also have some properties
fluoride
in the toothpaste.
in it.
Yes,
Okay.
it can help.
You were going to say something about the teeth.
Yeah,
Yes.
there are some chewing sticks that have some antibacterial property, so they help. But the thing about chewing stick is that they just hold it in the mouth. So the mechanism of using it, some people actually chew it well and still manage to get it into the corners.
Yes.
But most of the time, just do the front part and then leave the stick and join the feed of it, or just spitting out. So it's mechanical, but it's not thorough.
Well, I think we are fast running out of time. It's been a pleasure having you. So what we will do is we'll allow you to say your last words. Then I will get Lolly back so that we can do a little bit translation before we leave our viewers. The time is coming fast for the news time. So I will start with Dr. Omoje. Maybe your last word that you want to tell our viewers before you go.
Most dental diseases are preventable, largely preventable. And the most common cause of most of the dental diseases that we'll show you in the future course of our presentations here starts with poor oral hygiene. So when you can maintain good oral hygiene to a very reasonable extent, you have taken care of most dental diseases.
Thank you very much, and definitely we'll have you again in this program at some point to talk in more details about oral hygiene. Thank you so much for being here. Doctor?
Then I just want to, I know Dr. Omoje mentioned the fact that in pregnancy you can also have gum disease. And it's very important for the pregnant ladies to know that that's why some of them develop that. It's not that they're going to die. So they need to, I think if we put it in the antenatal health thing, that they should also have some scaling and polishing, or be aware that because they are pregnant and because of the hormones, they could have problems with their gum, and just go for help before they have complications, because we still see many of them in the clinic.
So thank you very much once again, Dr. Omoje, for being here. It's been wonderful. We've learned, I have personally learned a lot, and I think with this issue of the antenatal, maybe it is something we need to do centrally in the teaching hospital, where we collaborate with the gynecologists and tell them that, look, maybe when the woman is pregnant, incorporate sending them to the dentist to do some scaling and brushing during their pregnancy to prevent gum disease. Mbokk yi kon waxtaan bi gudda na lool, foog naa ne dinaa jël rek 2 minutes ma waxtaan Omoje lan la fi mujjee wax. lu ma ko laajte mooy am na ñu bëri dañ dee di use soccu ci Gambia fii nii, te am na ñu bëri ñoo xam ne gëm nañ ne mbir mu baax la. yow loo ci wax mu ne waaw mbir baax na lool, waaye moom lu mu dee def rek mooy daf dee génne tilim si biir gémmiñ bi. amut garab yi nga xam ne moo àndaa toothpaste nga xam ne moom daf dee di yokk wér-gu-yarami bëñ bi. so soccu bi dina génnee tilim waaye amut garab yi nga xam ne moo nekk ci biir toothpaste bi nga xam ne moom lañ dee use brush bi pour mu yokka wér-gu-yarami bëñ yi. moom si gàttal loolu la wax. kon lu ma ko wax rek mooy ne kon dafa mel ni kon ñi nga xam ne dañoo soccu ñoom it tamit nañuy toppatooyee seen gémmiñ yi ak toothbrush ak toothpaste, parce que loolu noonu tamit dina leen dimbale si yeneen anam. foog naa ne dinañ bàyyi loolu li mu wax loolu noonu si kàllaama Mandinka, moom tamit mu tàggatoo, man ma tàggatoo, ñu door a bàyyi leen ba beneen yoon insha Allah.
abarka docteur Omoje ala banta kumol min fala mi anko wala mu ñinin karoti docteur ya ñinin kamina wala mu ñinjo sironte fo fana kumatale pour mol kay muna fangal wala pour mol kata ka ke da courante ako ñinjo siron mu fene de mi ya lonko ase no bondi da kono bari jata kende mi ya lonko wala mu joranolti toothpaste ni min tata ñol o man tara ñinjo siron to ise ñingo jo sinol sene bari comme jata kende ala fanala ate tankandinol woto hani bi bi brosol wala nyim brosira wala mukudimi yanko wala kumada adu mol nyanta kata ko kala kaje ko di ngosto anata milla ban kumoto wala mu mol milia lon ko janni be lale ke da brosle ni wulta samandala ise do moro keno foy pare yana yeda ku a molti mi yanka wala jama rodi bari mol mi yalon ko ke lale buke dal brosi ni wulta samandala janni be domro kele tanyante da susala fa sene ndu nyanta kala sinya fula wol be mo kulti mi yalon ko ay woldi woto jara kende am kulen mi yanko nyinjo naka amuta dro nyin da ko mu fenet mi yanka kumata bake bari atem kuran mi yanka anin kuran do lebe chokiri nyola balola fanna nyinto.
Thank you very much Lolly mbokk yi ñu ngi naa gërëmaate si déglu bi lu Lolly yokka léegi nii rek foog naa war naa ko wax mooy nga xam ne dañoo broche seen gémmiñ ci guddi balaa ñoo nelaw suñ eewoo mun nañu raxas seen gémmiñ rek ak ndox ñu lekk ba pare door a brochaate waaye ki nga xam ne nag broche ut gémmiñam si guddi ci suba si balaa moo lekk war naa broche gémmiñam loolu rek lañ leen amaloon tey nag ladies and gentlemen, this is all we have for you today. We thank you for joining us and we promise that we will bring our esteemed doctors back in here again to discuss more in details of the teeth because this is a very important topic. Thank you for tuning in.